The Centers for Disease Control and Prevention, or CDC, funded the Denver Prevention Training Center's Capacity Building Assistance, or CBA program, for high impact prevention program integration. The CBA funding has 4 goals: reduce new HIV infections, increase access to care for persons with HIV, improve health outcomes and reduce mortality for persons with HIV, and reduce HIV-related disparities. The funding accomplishes its goals through 4 separate components: national training, both classroom and e-learning, regional technical assistance, continuous quality improvement and sustainability for community-based organizations, and marketing and administrative support for the CBA provider network. Finally, the CBA programs seek to address health disparities and social determinants of health and provide culturally competent and responsive HIV prevention services. The CBA project is funded to provide training and technical assistance to health departments and their clinical partners in the western part of the United States. Hello everyone, my name is Zami Tinashe Hyemingway. My pronouns are Zami, he, and him, and I'm the Capacity Building Assistance Manager, or CBA Manager, with Denver Prevention Training Center, and one of your hosts.
Hi everyone, my name is Ms. Jai Smith. I use she, her, and he, him pronouns. I'm the CEO of Toadhenge Consulting and an identity consultant with Denver Prevention Training Center.
So thank you so much, Ms. Jai, with being one of my co-hosts or my co-host for this episode and this season. We're so excited to be on this new adventure together. So why don't you tell the audience, what are we doing here today?
Yeah, we are here to talk about trans and non-binary communities that we are both part of. We're here to talk about our health. We're here to talk about social determinants of health and how we can help to end the HIV epidemic.
And not just how we can help in the HIV epidemic, but things that you all can do as well to support your local transgender and non-binary communities in their economic development, as well as ending the HIV epidemic. So Ms. Jai, we've already been using quite a bit of language, such as transgender, non-binary, and social determinants of health. So why don't you help me clue in the audience about what we mean when we say these words?
The first definition is gender identity. Gender identity is how a person internally and individually experiences gender. These are someone's thoughts and feelings about their gender and how it aligns with or differs from their sex assigned at birth. Gender identity is not always outwardly visible to others.
Our next definition is gender expression. Gender expression is how a person externally expresses their gender through behavior and outward appearance, such as dress, hair, makeup, body language, and voice. A person's chosen name and pronoun are also common ways of expressing gender.
The next definition is transgender. Transgender is when someone's gender identity does not match their sex assigned at birth. Transgender is an umbrella term that is used to describe a diverse community of gender identities. The identity language we may use is trans man and trans woman.
Next, we have non-binary. Non-binary is when someone does not identify with the gender binary of man or woman. Non-binary people may have a gender that blends elements of being a man or a woman. The identity language we may use is non-binary assigned male at birth or non-binary assigned female at birth.
The next definition is cisgender. Cisgender is when someone's gender identity matches their sex assigned at birth. The identity language we may use is cisgender man or cisgender woman.
Ms. Jai, so there's one more definition that we want to share with folks, and it's actually the name of our web series, which is Social Determinants of Health. So what does social determinants of health mean?
So social determinants of health are conditions in the places where we live, learn, work, and play that affect a wide range of health and quality of life risks and outcomes. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local determinants.
So that is a whole lot.
Yes, it is.
So what does that really mean?
So really what it is, social determinants of health are the factors that create barriers or allow the facilitation of us to live healthful lives. And we talk about them in the context of a couple of different categories. So those include education access and quality, neighborhood and built environment, social and community contexts, healthcare access and quality, and economic stability.
Awesome. And we know that for transgender non-binary folks, that shifts just a little bit, and that there's really 6 main spheres that impact our community. So some of that, again, is education and access, healthcare and access, police interactions, public policy and accommodations, housing, and then economic stability and employment. So Ms. Jai, now that folks know what social determinants of health are, let's go a little bit deeper and talk about how social determinants of health actually impact our health. Starting with, how does social determinants of health impact mental and behavioral health for our community?
That's a great question. So mental and behavioral health, if we think about even at the basic level of healthcare access and quality, if we don't have health insurance, it's difficult for us to even see a mental or behavioral health, a therapist, anyone who can help us with navigating our mental health needs. So that's one of the first things that I think of is, do we even have the ability to see someone for our mental health?
Right, and when we think about some of the categories, so we know the next couple of episodes, we're really going to be focusing on economic impact and employment, right? Mm-hmm. And many of us, we access mental and behavioral health services through the insurance we get through work. So if we don't have employment, if we don't have economic stability, how are we going to even do preventative measures around our mental and behavioral health, right?
Absolutely, and I think about two policies, right? So if we have policies set up with health insurance or policies in our where we're living, where we aren't able to get to a health provider. So maybe we don't have access to transportation, so our built environment isn't set up for us to actually get there. Or there are policies where we can't utilize telehealth in order to start our care. Then that's going to make it more difficult for us to get our health needs met.
Right, and so accessibility around our mental behavioral health is really important. And so you mentioned transportation, but I'm thinking about our trans and non-binary siblings who live in more rural and frontier areas, right? Mm-hmm. So even if you might have health insurance that has access to a mental or behavioral health specialist, if you live almost an hour away from that specialist, it's going to be very difficult to get there. And again, if you don't have employment or the economic stability to really help you with that transportation, how are you even going to take that hour drive, right?
Absolutely. And this is all access. If we think about the other social determinants of health, so what does it feel like for us when we are constantly being misgendered on the job? What does it feel like for us when we are constantly having to jump from job to job because they don't feel safe for us? Or we're putting in dozens of applications and no one's calling us back because we've included our pronouns on our resume, right? So that also leads to its own stresses, its own anxiety-inducing depression. There are all sorts of ways that can directly impact our mental health, not even in an access context.
Exactly, and even thinking about, okay, you put your resume in, you get called for an interview, you go for that interview and you show up as your authentic self, and because maybe you're not appearing in the way that they expected you to, then all of a sudden you don't get the job. And you know it's because you showed up being who you are, and it's based off of your gender identity. You know, the type of psychological distress that creates for our community often goes overlooked. And so when we think about mental behavioral health needs as well, we think about just how society institutionalizes or how society makes it acceptable for transphobia to happen, right? And for discrimination around employment to happen. And how that really does have an impact on our mental and behavioral health as well.
And so we're talking a lot about employment and access to employment and what that means for us and economic stability. But if we think about all social determinants of health, and we think about the ways that we are treated as trans people in society, we're oftentimes pushed to the margins. We're oftentimes regulated and criminalized for the ways that we engage with ourselves and the ways that we live our authentic lives. And all of that is going to negatively impact our mental and behavioral health because it's this constant weight on our shoulders.
Right. And when we think about some of the numbers around social determinants of health, particularly around mental and behavioral health, we know that over 20% of trans and non-binary folks have suicidal ideation, experience a large amount of psychological distress, have had depressive episodes, and that about 30% of us also have diagnoses, mental health and behavioral health diagnoses that greatly impact our ability just to show up in the world and be able to optimize our health, and thrive.
Absolutely. And we know that there are communities within the trans community where those experiences are much more prevalent. So younger trans folks experience it more frequently. Folks who also have a co-occurring disability experience more frequently. Black, brown, and indigenous trans and non-binary people experience mental health challenges more frequently, and there's less access to those services.
Right, and not to mention trans and non-binary folks who are living with disabilities, trans and non-binary folks who might have neurodivergence as well, and then trans and non-binary folks who are veterans from the military, which is one of the #1 employers of trans and non-binary people, right? And so going off to active duty and then coming back potentially with PTSD or post-traumatic stress disorder or post-traumatic stress syndrome and have to re-engage in the community living with these additional mental health barriers.
Yeah. So social determinants of health impact our mental and behavioral health in a lot of different ways.
So Ms. Jai, we've been talking a lot about risk and assets to care when it comes to mental behavioral health, but I'd love to know, how do social determinants of health impact our access and risk when it comes to sexually transmitted infections?
Yeah, with sexually transmitted infections, and we can talk about HIV, we can talk about hepatitis C, we can talk about gonorrhea, chlamydia, HPV, right? We see that our social determinants of health at, a base level, impact our ability to access the services that we need in order to get testing, in order to get treatment, in order to recognize when symptoms are, if a rash is more than just, this is because of the heat, or is this a rash because it's a sexually transmitted infection and requires antibiotics or requires medication or treatment. So at a base level, our social determinants of health impact our access to being able to get services related to an STI. And so what ends up happening is that folks end up living with an STI for much longer than they anticipate because they either don't recognize that something is wrong, or there's a fear of going and seeing a provider, especially for trans and non-binary people, a fear of seeing a provider and experiencing discrimination at the hands of a provider. And we know that a lot of trans and non-binary people, one of the main barriers to healthcare, one of the main barriers to getting our health needs met is at the provider level.
So let's look at this a little bit at the intersections. We're talking about ending the HIV epidemic, and we know that for Black, Indigenous, and Latina trans folks, particularly trans women of color, are disproportionately impacted by HIV. And although we know that the numbers of newly diagnosed HIV is coming down, when it comes to transmasculine folks, for example, trans men of color, we see that those numbers are going up. So what's your take on that? Why do you feel that maybe that's happening?
So speaking to the social determinants of health, when it comes to the creation of programs for prevention of HIV, for creation of programs to treat HIV, to get folks linked to care, those are often built based off of the data and the information that we already have. And I think what we have seen for a long time for trans and non-binary communities is a heavy emphasis on trans women, and specifically trans women of color, around HIV prevention and HIV care, and an assumption that trans men are not at risk, an assumption that trans men do not engage in sexual behaviors that could potentially lead to an HIV infection, an assumption about who trans men's partners are. And this isn't even to talk about non-binary folks who are almost completely absent from any sort of data collection or discussion on the health of folks within the trans community. And so because of that, we see this in terms of social determinants of health, we see that programs are created that don't include trans men, that don't include trans men in the evaluation, that don't include trans men in the development of the program, that are not marketed towards trans men and do not meet the needs of trans men. And so of course, we then see an increase in new HIV diagnosis, we see an increase in or a lack of access to medical care for trans men around HIV care. And we hear these stories of trans men who are living with HIV or tried to access preventative services and were denied. And so, or are living with HIV and were denied treatment or were unable to find treatment that met their needs. And so what we're learning now is that now that we're actually asking trans men what their experiences are, we're finding that, oh, actually, the experiences are similar to trans women, the experiences are similar to communities of cisgender men who might also be at greater risk for HIV. And so we've really done a disservice. And that policy is how this impacts health, specifically around HIV acquisition and transmission.
Yeah. And, again, thinking about access and thinking about programming, historically, majority of the programs around HIV and prevention for HIV and care for HIV historically have been created for cisgender white men, right? And so when we start to go for creating holistic programs and developing programs for trans and non-binary people, we have to do so at these multi-layers, right? We have to make it culturally available to folks, right? So access isn't just about whether or not you can pay for the service or whether or not you know the location to get tested, but is this a location that knows how to work with folks of color? Is this a location that also speaks the language of folks? So if you have a trans masculine person or a trans woman who is undocumented and maybe a monolingual Spanish speaker, can they come to your organization and get testing for STIs and HIV, and the information can be given to them in Spanish as well? And are they also going to be affirmed in their gender and not misgendered or, misnamed when they access the resources, right? And I'm just also thinking about for education, right? There's a lot of opportunities to prevent contracting HIV. We have PrEP, for example. We have multiple forms of PrEP now, injectable PrEP from, taking it orally. And so thinking about the different prophylaxis that folks can take to prevent HIV and some of the ways that education isn't getting to these different parts of our community is really doing a disservice. And so I'm just wondering, when we're thinking about access, what are some ways that organizations and clinics can actually make PrEP accessible to trans folks and non-binary folks, particularly trans masculine folks, non-binary folks, and folks of color?
Yeah, I mean, some of the initial things that come to mind is include trans people in the development of your programs. Make sure that trans people are reflected in your staff and are not just the staff that are directly providing services, but are part of organizational leadership. And we'll talk about this more throughout the course of our show, because we're going to be talking about employment and we're going to be talking about economic opportunities. But I think that these are ways that we can start to make sure that we're developing programs that actually meet the needs, and also stop treating trans people as a monolith, because we are not the same. My health needs are not going to be the same as your health needs, right? And what's going to resonate with me, especially around things like health messaging, around whether or not a space feels safe, is not going to be the same for me as it is for you. And I think that that is really where we've missed the mark in terms of STIs and HIV, is being able to treat trans people as the diverse community that we are, because of the assumption that all trans people are the same, or because of the hyper-focus on one subset of the trans community.
And I would also just add to that, making sure that trans folks and non-binary folks know that you can get PrEP for free. There's all these programs out there, right? How much money you make, finances should not be a barrier to our health, right? And we know a big barrier for the trans and non-binary community because of employment discrimination is economic stability. And so making sure that as a health department, as a clinic, as a community-based organization, that your trans and non-binary clients know that you have free resources, that you can get on PrEP and you don't have to pay for it if you can't afford it. So making sure everyone knows that, particularly those pushed furthest to the margins.
Yeah, and back to the social determinants of health, we also work within a very bureaucratic system in healthcare. And so even though PrEP is available for anyone who's got insurance, if you're on Medicaid, if you're on private insurance, even if you're uninsured, you can still get PrEP covered by the manufacturer. Even though that is a possibility, we still see this rigmarole of trying to jump through hoops in order to get our coverage, in order to get our medical needs met. And healthcare access as a whole is a big sticking point for our community, for trans and non-binary people, because if we think about even legal documentation and identification, if my legal name does not match the name that I go by, if my legal gender marker does not match the actual body that I have, or my identity, we're going to see across systems that these systems are going to start suddenly throw up red flags, and it's going to be harder for us to get our care. So I might get prescribed something that doesn't actually work for my body, or is actually not going to provide me the same level of protection because the legal gender marker says, oh, this should work for me. but it doesn't actually work for me. So it also is this piece of how are we talking to our communities and how are we actually treating individuals as individuals when they come in to see us and asking them about their bodies and asking them about what's going to work best for them.
Right. So it's all about, let's not make assumptions and let's ask a lot of questions.
Absolutely. Yeah. So you've asked me a couple of questions. Now I'm going to ask you a question. Okay. How do social determinants of health impact urgent and emergency health needs?
You know, this is a really great question. I'm happy you asked it, Ms. Jai, because one thing that I feel a lot of folks don't know is that transgender and non-binary people live with quite a bit of chronic illnesses and disabilities. And some might say, why? You know, well, thinking again about some of the social determinants of health and those 6 spheres that we talked about for trans and non-binary folks, one of the things that we said was that public policy and accommodations, police interactions, that those are a part of the social determinants of health for our community. And because of the discrimination that happens through public policy and accommodations and through police interactions, over 30% of transgender and non-binary folks will avoid seeking care unless it's an emergency, which means different health needs that could be preventable, different health needs that could be treated, and then you go about your way, often get ignored because of fear of discrimination, trying to access care, because of fear of discrimination, being misgendered, of being assaulted. You know, what most folks don't know is that 2% of transgender and non-binary folks who are trying to access care actually are physically assaulted when attempting to access care.
Yeah, exactly. I think a lot about, too, what it takes to get to that door. So in my work, I think a lot about how we want every door to be the right door. We want to make sure that if a trans or non-binary person comes to a service, whether or not that's the service for them, that they are still in the right door. We're still going to be treated with respect. We're going to be treated with empathy and compassion, and we're going to be able to get connected to what we need. And we have to recognize what it takes for us to get to that door. It could be taking public transportation where we're being harassed on the bus or harassed on the train or harassed on the subway. It might be that we are having to move through a neighborhood that is not supportive of gender diversity, is not supportive of trans folks. It could be difficult for us to step outside. We have to steel ourselves against the outside world just to go grocery shopping. We have to prepare ourselves for when we are going to go out into a world that does not treat us as human beings. And when we are going to a space where we are also going to be additionally vulnerable because we are unwell. I don't know about you, but for me, when I'm sick, I'm a baby. I am a big old baby. Like, I want to be taken care of. I don't want to cook for myself. I don't want to clean. I don't want to do anything. But if we are having to steel ourselves and then step into this vulnerability of also being unwell, then it means that we are opening ourselves up. It means that we're opening ourselves up to so many more opportunities for folks to mistreat us. It means that we have to be prepared for it to hurt more. And that can be really terrifying. And so, yeah, if I bump my toe and I'm like, well, it's swollen, but it doesn't feel broken, so I'm not going to go to the emergency room because it doesn't feel broken, then I might be walking around on a broken toe because I'm afraid of how I'm going to be treated just stepping into that space.
Right. You know, and I want to circle back a little bit to every door should be the right door. You know, really what you're talking about is a status neutral approach to care, right? So it's not just about creating gender affirming health spaces, but it's also creating a status neutral health space, meaning any door I go into, regardless of what my diagnosis is, regardless of my gender identity, regardless of my sexual orientation, my race, ethnicity, every single door is the right door for me to come in, and I'm going to be met with dignity and respect. And really holding to task clinicians and physicians around do no harm. You know, again, 2% of trans and non-binary folks are assaulted when they go to seek care. And so getting to this place of, okay, you get access to healthcare, you finally have health insurance, you make it through all the harassment, going through the bus, the taxis, the metro, whatever system you're on, you make it into the lobby, and then the front desk person misgenders you in front of everybody there. Mm-hmm. You know, it goes back to the other question around psychological distress and the impact of social determinants of health on our mental and behavioral. You know, that creates another illness for us, right? And when we think about the chronic part of it, you know, chronic is 6 months or more. And many trans and non-binary people are living with chronic states of illness, whether it's mental and behavioral or physical illness, due to fear of being discriminated against and harmed trying to access care.
Absolutely. And when we think about the access as well, I also think about how emergency care is used. And so if we're having trouble with employment, if we're having trouble with full-time employment, we don't have health insurance, maybe we live in a state that does not have Medicaid expansion, so we are not eligible to enroll in Medicaid. So we are uninsured, we're more likely to use emergency services for non-emergency conditions as well. So even though it might be terrifying for us when we do work up the courage and we are like, you know what, I really should get this checked out, I don't have a primary care doctor. I have to go to the emergency room because I know if I go to the emergency room, they'll try and charge me, but at the end of the day, if I don't pay that, it's not going to be as big of a deal because they've got all of these programs to cover it, or it's not like at the end of the day, I just need to get this need taken care of. And so we're not able to make a connection and make that long-term connection as well. And so then trans people are seen as clogging up emergency care, are seen as you're clogging up this system to have this need met when you could just go to a primary care doctor, but it's not as simple as just going to a primary care doctor.
Exactly. You know, and so we've been talking a lot about like the emergency aspect of it, right? But we know chronic illness isn't just emergency, right? Chronic illness is something that we live with every day. And we know, again, trans and non-binary folks are not monolith. And so, you know, what I'm thinking about are trans and non-binary folks of color, for example, who might be living with multiple different forms of social determinants of health. You know, so if you are a Black trans person, you might be more susceptible to stroke or hypertension, you know, might be living with sickle cell anemia, thinking about folks who might be living with the HIV diagnosis as well. And so if you are a trans or non-binary person living with the HIV diagnosis, but you don't have a provider who is gender affirming, you might avoid going to see your infectious disease specialist, which means you could run out of your HIV medication, which can cause you to be more susceptible to getting things like pneumonia. You might be living with diabetes as well. And again, going back to economic stability, if you are financially unstable, then you may not have access to healthful foods, right? And so your nutrition practice may not be the best for you, so you may not have the best diet, which will impact your diabetes, which can have a negative impact on your HIV. And then you also ran out of your HIV medication because you have a transphobic doctor. It's just this downward spiral, right? And impacts, again, our ability to optimize our health, our ability to thrive, and just continues to see that within the trans and non-binary community, these are the reasons why so many of us live with disabilities and chronic illness.
And I think that you've really encapsulated it very well of how this becomes a snowball. How it is not just, well, this one thing is happening to me. So it's not just one thing took place and this is the one health condition I have. It's not just that I am managing my HIV. It's that these start to snowball because of the way that we are treated in health environments, because of the ways that we are treated in our neighborhoods, because of the policies that are created locally and at state levels and federally that criminalize transness. And it results in these what could be manageable conditions becoming emergency conditions, becoming chronic conditions. And so it's really important for us to keep in mind when we're thinking about social determinants of health and emergencies, that oftentimes these emergencies could be treated earlier, could be prevented if we were treated equitably in these same environments.
And so, Ms. Jai, what we're really talking about is because of all the chronic illness, the lack of preventative measures for trans and non-binary folks, what we're really seeing is that trans and non-binary folks have a lower life expectancy than most cisgender people. And so what that means is that more of us have a higher mortality rate or are living shorter lifespans than we could if we had health equity, if we had access to preventative measures, and if we did not live with the fear of discrimination, harassment, and assault just from trying to access care.
So bringing us back to what we're talking about for our show, for our series, I have a final question for you. How do employment and economic stability ultimately impact our health outcomes?
Yeah, you know, one of the things I feel we've mapped out is all the ways that lack of financial stability impacts our health, right? So again, when we think about how folks in this country actually have access to health insurance, is through employment. Majority of us have health insurance through our own employment, through the employment of a partner or a spouse, through the employment of a parent or a guardian, right? And or even through education, right? So when I was undergrad in college, I received health insurance not only through my mother, but also had health insurance through my university. So when we're looking at social determinants of health, we know that education access is one of those social determinants, and many trans and non-binary folks aren't receiving higher education as a social determinant of health, right? So that automatically removes one way for them to have insurance. When we think about employment, if we aren't being employed, if we do not have, not even just employed, because you can work 10 hours a week, but that really doesn't qualify you for health insurance, right? Many folks have to work at least 20 hours, so at least part-time, to receive health insurance. And so we don't have stable employment, if we don't have employment that is actually, what's the word that I'm looking for? Many of us are underemployed. So we don't have employment that's not underemployed, so part-time or full-time employment, then we don't have access to insurance, or we have to have insurance through the state system. And navigating the state health insurance system can also be very difficult. So if we, again, economic sustainability, stable employment really does impact whether or not we have access. So never mind having a provider who's gender affirming, if you don't have insurance to even see a provider, it just throws that all out the window, right? So at the end of the day, if we don't have employment or economic stability, we can't even begin the conversation around access to healthcare and living a long, fruitful life.
Yeah, absolutely. I also think that, again, beyond just access, if I can't afford healthful foods, nutritious foods, right? The cost of eggs are going up. We need to talk about it.
I don't even eat eggs anymore.
Yeah, but the cost of basic essential food items, the cost of produce is going up. The cost of our ability to buy nutritious foods, if we even live in an area where, or can afford to live in an area where we can get regular fresh produce, right? So food deserts are also a thing. These are things that will be impacted by whether or not we have a sustainable or consistent income, and whether or not our income is actually going to be at a level where we can survive in the areas we're trying to live.
Yeah. Like something that just came to mind is if I have to buy food or pay for my medication, what am I gonna do, right? And thinking about economic stability, if I am underemployed, if I have to decide between life-saving medicine or whether or not I'm gonna eat or whether or not my family is gonna eat, I'm probably gonna make sure that I eat and my family eats, right? And these are things that we have to think about. Economic stability and underemployment doesn't just impact trans and non-binary folks. We are the population that are greatly impacted when we look at the numbers. Trans and non-binary folks are almost 3 times more likely to be unemployed, and we'll take a deeper dive in that in our next episode. But this also impacts cisgender folks. And so we really need to think about how do we make employment, how do we make healthcare, how do we make these things equitable so that those pushed furthest to the margins are able to thrive and don't have to decide between medication and food.
And I think this comes up a lot. We mentioned mental and behavioral health before. I think this comes up a lot for whether or not we can see therapy as an expense of something that we can afford, because oftentimes therapy is seen as a luxury. And so it becomes this piece of like, well, I will see a therapist when I can afford a therapist, but then we never get to the place of affording. And I remember for myself working in a full-time job, entry-level position, because that was what I was qualified for, based off of my education level, and I had already run myself into debt as well for my education, and still having to go to a food bank in order to be able to provide for myself and my partner. So I think that there are a lot of ways too where our community is almost regulated to these positions that are entry level, that are right to work, or are gig based. And so we step into these positions and it's just not consistent enough for us, or the amount of money that we're making is not enough for us to actually survive.
Yeah, and I think for some folks, thinking about health departments, community-based organizations, or really any employment system, right? We know that a lot of trans and non-binary folks end up working into nonprofit, or end up working at local clinics, particularly working in HIV and AIDS prevention, right? And so when I'm thinking about what these jobs do. Many of us start in entry-level positions. Most of those entry-level positions barely cover our basic living expenses. But also, I think that sometimes the organizations don't always see the value in paying their employees more, right? You know, when we have economic stability and we have, we have employment that is really stable for us, that has a great impact, not just on the agency, but the community. Because if we have more people who are able to afford preventative medication, are able to go to their doctors, are able to get in mental and behavioral health services, are able to pay out for their medications, then we have more folks who are well, right? If we have more folks who are eating healthy, then we have more folks who are experiencing less chronic illness. And when we have more folks who are able to engage in STI prevention and care, then that means we have less infectious diseases in the community. And our community as a whole is able to thrive and be healthier. And then that also means you have less employees calling out. You have more employees who are able to engage from grounded places in the work environment and really be able to invest. And so you have a stronger workforce as well. And so I think that many folks, they look at economic stability and employment as a very individualistic thing, that if I pay this person more, then I'm only helping this one individual. But when you pay all of your employees more, when you're able to employ trans and non-binary folks, not just in entry-level positions, but throughout your organization, and be able to really invest in the financial stability of those pushed furthest to the margins, we all benefit from it. And the organizations benefit. And when we are all healthy and happy, imagine what we can do in this world.
It's wild. It's wild to think about, because we're deserving of our time and our energy and our labor and our expertise to be compensated. And oftentimes I find working as a trans person both of our fields, we're stepping into public health and stepping into a healthcare organization, or it's in some way. And I feel like oftentimes we become the experts, or we become tapped to answer all things transness. And folks don't see how that also benefits the organization. Like, hiring trans and non-binary people and having trans and non-binary people in your programs is going to help you better serve trans and non-binary people.
Thank you all so much for tuning in for this episode, and thank you, Ms. Jai, for the amazing conversation. If you like this and you would like to learn more and get more information, please visit us at www.denverptc.org and sign up for technical assistance and capacity building.
And if you enjoyed this episode, please like, subscribe, share this with a colleague, let them know what this is about. And join us for our next episode, where we'll be talking about employment discrimination, economic stability, and our health as trans and non-binary people.
Till next time.